This conference will now be recorded.
Hi, thank you so much for joining the TePe Team Huddle. My name is Heather Kelly. I am the Professional Relations Manager for TePe Oral Health Care. I am also a dental professional and a dental hygienist, so I really hope this presentation gives you a good introduction to the products. So first, we're going to just show you a little bit of background about who TePe is, and then we'll get into our product portfolio, showing you some of the clinical photos. TePe's vision is to bring healthy smiles for life by inspiring good oral health. We truly believe that you can keep your teeth for a lifetime. So what we do, we develop, manufacture, and sell high-quality functional oral health products in collaboration with dental experts. Well, what does this even mean? Basically, it means that we have our own product development department, and they develop ideas together with our dental team and external input from dental professionals. We also have engineers who design and build our product machines, and we produce the products in our own production site, and we sell to customers all over the world. TePe solutions are developed and made in Malmö, Sweden since the beginning, when the company was originally founded by the Eklund family in 1965. Today, we are recognized as a global leader in health awareness and education, and we are still family owned. So here are just a few milestones in TePe's development. 1965, Henny Eklund founds TePe and invents their first oral health product, which was the wooden triangular dental stick. 1973, we got our toothbrush. 1993, interdental brushes. 1997 began the international expansion. 2012, Joel Eklund, the third generation of the Eklund family, took over the leadership. 2014, TePe launches their innovative TePe Easy Pick. 2015, 50-year anniversary, and they established the Eklund Foundation, which I'm going to briefly show you in the next slide. 2018, they became Malmö's largest solar power plant, which was opened at TePe's headquarters. 2019 was the international introduction of TePe's sustainable oral health range. And then in 2020 was the global launch of TePe Share, which is our website created by dentists at our headquarters for health inspiring knowledge and education for everyone. So this is a little bit of information about the Eklund Foundation. The founders of TePe, the Eklund family, established the Eklund Foundation to support research. They distribute funds to high quality research projects, and the application period starts May 1st, and the last day of submission is May 31st. In 2021, the foundation awarded nearly $260,000 US. So education is definitely a priority for the company. Today, we have subsidiaries in 8 countries that cover 20 countries. Australia has been the latest one. We have further 60 distributors that then cover 80 countries. So in total, TePe is in 100 countries. So if you're good with your geography, Malmö, Sweden is located right here. And I know sometimes we say TePe, 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 TePe. You can say it however you want because we're in so many countries, it's pronounced different all over the globe. TePe has created a digital document called a quick guide for dental professionals, providing you the resources you need. We will send the link to this document in a follow-up email. Within this digital document, we discuss why you may choose TePe, information on us as your dental knowledge partner, how you and your patients can access products, how to grow your business with TePe, and in-depth information on our product portfolio. Today, you may be asking yourself why you might choose TePe products as a recommendation for your patients. Here are 5 reasons we believe you would choose TePe. Quality and functionality, a brush for every need. We offer competitive pricing, education, and sustainability. Innovative ideas meet advanced technology in product development and manufacturing. A brush for every need. Interdental brushes in 9 sizes, along with a range of toothbrushes and specialty products to cover every patient's need. We offer competitive pricing, saving you 15% or more by choosing TePe. TePe Share is a place to be informed, inspired, and educated. It was created by dental professionals at our headquarters in Sweden. You have access to scientific articles, tutorials, research, instructional videos, and blog posts on oral health topics. It is a wonderful way to gain a global perspective on oral health topics because we offer live webinars and a symposium once a year, and I really like it because they have speakers from the EFP or the European Federation of Periodontology. Sustainability at TePe means ensuring environmental, economic, and social well-being for today and tomorrow. One example is the solar panel roof at our production site that is complemented by wind power, enabling the entire production to be powered by 100% renewable energy. So here's a photo of part of that solar panel. We actively engage in development of eco-friendly solutions and aim to eventually become independent of fossil fuel raw materials in product and packaging. Our aim is to have TePe's products carbon neutral in 2022. We hope this has given you some background about the company, and now we're going to explore some of the products. So again, today we'll discuss the products, how to access the products, and how to grow your business practice with TePe products. When you visit our website, tepeusa.com, and hover over the products tab, this is what you will see. This is our product portfolio. There is a brush for every need focusing on cleaning between the teeth, toothbrushes, specialty brushes, and in specialized dental care, where we offer kits as a solution for specific needs. For example, if your patient might have implants or ortho. So when you look at the cleaning between your teeth option, TePe offers interdental brushes with different designs and bristle textures, a mini flosser, bridge and implant floss, dental tape, and our rubber bristle brush, which is called the TePe Easy Pick. Our toothbrushes are designed with a broad ergonomic handle, narrow neck, tapered brush head to reduce gag reflex, and gentle high quality bristles. So here's some of our toothbrushes. We are moving all our toothbrushes into a more sustainable plastic, but it all started in 2019 with the TePe Good. It's a bio-based material, meaning comes from a plant source instead of fossil fuel. The TePe Supreme and TePe Nova both have a silicone thumb pad and unique bristle design. The TePe Select has the same design as the Good. And the Color and the Kids toothbrush have a compact brush head size. Whereas the Mini, it's in that bottom toothbrush there, has an even smaller toothbrush head suitable for the first tooth to 3 years old. TePe offers many different colors, which is especially appealing for children. The brush head comes in 3 different brush head sizes, regular, compact, or mini. TePe is known for their interdental products, but they also have an amazing line of specialty brushes. As we look at the different brushes, begin to think about how you can modify your home care recommendation to meet the needs of your current patients. So here are just some of our different products. We have the Universal Care, the Implant Ortho, the Compact Tuft, the Interspace, Special Care, Gentle Care, and the Denture Care. We will be going over these more in depth later in the presentation. But if you just wanted a quick glance at some clinical photos, Here are 4 of the different specialty brushes and where you might use them. The last section we have on our website is called Specialized Dental Care. The first 4 items discuss healthy gums, braces, implant care, and children's dental care. Within these sections, TePe recommends solutions that would be suitable for that particular need. The tongue cleaner is designed to remove bacteria on the tongue. The design corresponds to the natural shape of the tongue, which reduces the gag reflex and makes it easier to reach far back in the mouth. It has 3 blades slightly raised to give that triple effect with one sweep of the tongue. So I often recommend for my patients to go down the middle and then toward each lateral border of the tongue. The travel case is excellent to have your interdental brushes on the go or for keeping multiple sizing options in one spot. The TePe Extra Grip is designed to fit most of the TePe toothbrushes and specialty brushes. It is dishwasher safe and easy to insert and remove. It provides an adaptive handle to assist cleaning by individuals or their caregivers, and especially it helps those with reduced manual dexterity or grip strength. Lastly, we offer Healthy Smile subscriptions, which provide solutions for oral health care needs. We have bundled our products together into 5 different kits called the Essentials Kit, Advanced Kit, Implant Care Kit, Ortho Kit, and Perio Kit. Within each kit are different products we believe will contribute to great oral health. First, you pick the program, and then by subscribing, you will get the kit delivered to you with a suitable interval, and then canceling is always easy. If you're not sure which products to start with, we have put together items we believe your patients could benefit from, specifically designed for general practice, ortho, perio, and oral surgeons. So hopefully that kind of gave you a good overview of all of our products. And specifically, we're going to start talking about between the teeth cleaning. So we're going to discover why interdental cleaning is so important. So periodontitis starts between the teeth. I love this survey. It's a little humorous. The survey was completed by the AAP, or the American Academy of Periodontology, in 2016, and it showed that 27% of US adults lie to their dentist about how often they floss their teeth. Also, more than 1/3 of patients would prefer these unpleasant activities to flossing. Cleaning the toilet, sitting in traffic for an hour, or listening to small children crying on a plane. We as dental professionals might not mind flossing our teeth, but some people really don't like it. Again, we need to be evaluating what interdental hygiene tool is the best method for that specific person. This 2018 meta-analysis does not refute the efficacy of flossing, but we should understand it's a technically demanding oral hygiene habit, and it's actually ranked low among other intraoral hygiene aids. Its application is elusive, so why is it still our gold standard of care here in the US? I know on like the CDC website, which is, they say brush twice a day and floss once a day. And I really hope that we can get away from this language and say brush twice a day, clean between your teeth once a day. We don't want to assume that every patient needs to floss as the best option for them. And then given the prevalence of gingivitis, we should be giving our patients an alternative to flossing, as this would likely have a significant public health impact. I know we keep saying individualized care, and this study was also very adamant about products being recommended to the patient based on their needs, rather than insisting on instruction on the use of a universally recommended cleaning aid. So just think about what you're giving in your goodie bag. Is it the same thing for every patient, or are you trying to individualize your recommendation? And in fact, when they looked at 10 different interdental aids, interdental brushes and water jets ranked the highest for reducing gingival bleeding, whereas unsupervised flossing did not show substantial reductions. I think we can get excited about this because it's just giving our patients more options and alternatives. You're doing great. After looking at this study, we'll start to look at the different interdental products. This study was published in 2016 from the International Journal of Dental Hygiene. This study's aim was to compare the effectiveness of conically shaped versus cylindrically shaped interdental brushes. And it concludes that the tapered or that conical cone shaped may miss the proximal surfaces. Interdental brushes were once sized for open embrasure spaces and posterior teeth, but we now have a multitude of sizes ranging from 1.9 millimeters to 14 millimeters in brush diameter. It can get overwhelming for our patients, so as the dental professional, we must be guiding our patients to the correct size. In this picture, the line angles from the lingual perspective are highlighted. Here is a visual of a conically shaped interdental brush or Christmas tree shape. Think of like a cone shaped, comes to a point. Notice how it may miss the proximal surfaces, those line angles. In this picture is a cylindrically shaped interdental brush. Notice how the bristles reach the line angles to disrupt the plaque. So what do we think about this flossing technique? Flossing technique is it's sensitive and it's difficult to master. So again, we should be asking ourselves if it's really the best method for everyone. There are many factors to think about when deciding which interdental aid to recommend to our patients. We must consider the anatomy of the area needing biofilm disruption, the level of dexterity of our patients, the technical difficulty of the task, the ease of use of the device, and our patient's motivation. This picture speaks 1,000 words and is a great learning tool for patients. This is an occlusal view of the morphology of posterior teeth. It shows the patient how our teeth are not blocks. There are grooves and depressions. It helps us understand why floss may be effective in between the anterior teeth with healthy tissue, but the morphology in the posterior may not allow for adequate cleaning with only floss. Also, notice the cylindrical shape of the interdental brush and how it reaches all the line angles, and how the bristles collapse as they are inserted and then fluff out. So that is in this picture right here. So you have all received this educational piece that we call the illustrator. And here you can see the image we just discussed. Below you can see interdental brush options and illustrations on where to use and how to bend the wire. There are also QR codes. This first one leads to educational videos. There is an entire library and individual videos for each product, and the videos explain the product details and then how to use each product. The second QR code leads to our website, tepeusa.com. And then the backside shows select products with illustrations and some clinical photos. This is laminated, so you can clean this for chairside educational use. And then, of course, if you ever need educational product, brochures, literature, please reach out. We can get that to your office. So now we're going to discuss some of our interdental cleaning options. TePe has 3 interdental brush lines: original, extra soft, and angle. It is the same wire diameter across all 3 lines for each specific color. So if you're a blue in the original, you'd be a blue also in the angle line. TePe original interdental brushes have 9 different color-coded sizes. The wire is plastic-coated, safe to use around implants. The shape of the brush is cylindrical, allowing optimal plaque removal. And then notice how that handle is short and broad for a steady grip. You can place the ventilated protective cap onto the handle for an extra extension in length. And then notice the 4 smallest sizes, pink through blue, have a flexible tip for better durability and accessibility to those posterior teeth. So press that flexible tip. And then once the diameter of the wire gets larger, you can bend the wire into a C shape for better posterior access. TePe's interdental brush bristles cover 98% of the wire, helping to avoid any gingival or hard tissue trauma. The bristles also have a close fit with optimal distribution just to increase that cleaning capacity. And then notice that you can use an interdental brush in more places than just between 2 natural teeth. You can use it around orthodontics, implant overdentures, or even where there are missing teeth. In this lower right picture, you see it being used where there is a missing tooth, and the black interdental brush especially is my go-to for this circumstance because you can see how it really gets all the line angles, can get under that mesily drifted tooth just from the buccal aspect. TePe extra soft interdental brushes have extra soft bristles for recommended use immediately following surgery. Patients undergoing radiation and/or chemotherapy treatment with the presence of mucositis, peri-implantitis, extreme sensitivity, or just fragile oral tissue. You will notice difference in the handle colors. They are all pastel to indicate the extra soft bristles. The angled interdental brush is especially useful for those with dexterity issues, for ortho patients, or accessing difficult areas from the lingual palatal aspect. The handle and brush are one piece and do not separate, and the brush is set at a 90-degree angle to the handle. When evaluating your patient's flossing technique, always be sure to observe for any signs of trauma. This image shows floss clefting, where they may be pulling the floss down into the interdental papilla instead of wrapping it against the tooth. For these individuals, the technique may be too difficult, and an interdental brush might be a better option. So the TePe interdental brushes are sold either in a mixed pack, 6-pack, 25-pack, or a practice box. Next, we're going to look at how to use an interdental brush and some frequently asked questions. So when inserting the interdental brush, we say wiggle or do a quarter turn to get the brush through the contact. This method helps patients slow down and keep the brush in that horizontal motion to prevent trauma or distorting the wire of the brush. Next, move the brush full length, back and forth a few times. Rinse and let air dry. You can put the cap on right away because it is ventilated, and you can also use the cap for an extra extension in length. For those back molars, bend the wire before inserting. Slightly close the mouth and push the jaw forward. Then proceed with all the instructions we just went over. So using an interdental brush. As the brush size increases, so does the wire. The bristles should fit snugly between the teeth, and there should be some resistance. The wire should not rub either adjacent tooth. Do not force a brush into a space. So how often should you use a brush? Like all interdental cleaning recommendations, once a day, preferably in the evening. Can you use the brush several times? Yes, rinse and let air dry. Remember, each brush will wear differently depending on the size of the brush and in how many embrasure spaces you are using it. The pink brush in the top picture may last a couple days, whereas the black brush in the bottom picture, which is large and it's only being used in that one embrasure space, may last you 3 weeks to a month. So when is it time to change your brush? Well, once the bristles start to collapse. I know it may seem like common sense, but if the bristles are collapsed, They will not reach into all the grooves and anatomy between the teeth. And how many brushes per patient? Hopefully not 7 like this picture, but on average we say 2. Of course, this is a very individualized recommendation. Your patient may need more. For example, if they have a missing tooth, maybe an implant, and then also healthy tissue, you might be recommending 3 different sizes, but then you must consider the motivation and compliance of that patient. Who should you recommend interdental brushes to? Anyone and everyone. Just have a purpose behind your recommendation. With such a large range of sizes, they really meet all Embrasure spaces, but again, really have a purpose behind your recommendation. And then which brush size to use? It should be noted that it should not evoke any signs of pain upon usage. In these next slides, we'll go over some specific tips on sizing. We all have a probe on our tray. After measuring many of them, most metal probes are close to the wire diameter of TePe's blue interdental brush. Using the probe as a sizing indicator can help get you close to your recommendations. Notice in this video how you insert the probe like an interdental brush in a horizontal motion. In this upper right quadrant, notice how it is not touching the sides of the teeth and it actually has plenty of space to move. So that means the wire of TePe's blue interdental brush would not touch the sides of the teeth, and the brush could actually increase a couple sizes. So in this case, we started with a green and ended with a purple. Here we tried to insert the probe, but it would not allow. So sized for a pink, and this was a great fit. So this might also be an area where floss could be recommended. Here we have a type 2 embrasure space. When the probe was inserted, it was not anywhere near touching the sides of the teeth. So here we sized for a purple for a great fit. The cylindrical shape and length of the brush allows access to the lingual line angles. If sized properly, the bristles can reach under the contact point. The brush cleans the entire embrasure space. Here is a type 3 embrasure space. There's attachment loss, the papilla is blunted and below that CEJ, maybe some recurrent decay around that class 5 composite, crown margins to maintain on tooth number 29. So here we sized for a gray for a great fit. Here we have an embrasure space that has inflamed tissue and a bony defect. After probing, there is a deeper pocket and tissue is shiny. This one you have to think a little bit about. Here you can see we used multiple sizes. We started with a red and then ended with a yellow. The wire was not touching either adjacent tooth, but please note that you should have your patient really demonstrate the technique back so you can confirm they are not creating trauma. Perhaps you may need to start with a smaller size until inflammation subsides and then enlarge the brush size. When we use interdental brushes in the anterior, we are always cautious to not blunt the tissue. In this case, we have attachment loss and the goal is to maintain the health of the papilla. The probe was not close to touching the sides of the teeth. So here we size for a green for a great fit. You will hear this a lot in dentistry, but it truly is an individualized recommendation, and please use your own clinical judgment. We usually use interdental brush in a horizontal back and forth motion, but you can see here it is angled towards the floor of the mouth to allow the bristles greater access around those crown margins, where calculus is likely to form. So notice how the wire is still not touching either adjacent tooth. We recommend you to have a practice box at your chair side. You have already assessed your patient and are familiar with the embrasure spaces. Pick 1 to 3 sizes from the box and try them on your patient. When you have decided which brush or brushes are the best for your patient, Let your patient then show you in practice. You can correct and then give tips. We think this gives much better compliance and just recommending a size without letting the patient, and you're also letting the patient really feel how the brush should feel. In a follow-up email, we will be sending these two documents on interdental brushes. The first one reviews how to size your patient, and the second one discusses how to use the interdental brush. The second one is intended for your patient. So here are just some questions to think about. During what part of the appointment do you discuss oral hygiene instruction? It's really best to give initial instruction after the assessment towards the beginning of the appointment. Here you can teach them how to self-evaluate because they may still have plaque on their teeth. And then you can repeat the goals throughout the appointment. How does the patient feel? If a patient is stressed or exhausted, they will not be as engaged and can't process the information efficiently. And then what are you recommending? Remember, individualized care is the best. Not every patient is the same. So this is TePe's rubber bristle brush, which we call the Easy Pick. We have 3 sizes, orange being the smallest, then blue, and purple's the largest. There are many advantages to the Easy Pick. The plastic core is both stable and flexible, and the silicone coating cleans efficiently between the teeth and feels comfortable on the gums. Has a long working length, and the shape allows for a large contact area for better plaque disruption. It is one shape for both anterior and posterior, being both flexible and durable enough to reach all areas of the mouth, as you can see in the picture. The travel case makes it convenient to use on the go. And then if you decide to distribute samples in your office, it comes in a dispenser box as seen in the picture with 100 samples and 2 in each of those samples. Many patients who are not compliant with interdental cleaning, but often do well starting with the Easy Pick and then transitioning into interdental brushes or another way to clean between the teeth. That's why we like to call it the gateway cleaning aid. In the top picture, you can also see how the Easy Pick can be used for gingival stimulation in areas of edema. The TePe bridge and implant floss is great for implants, bridges, orthodontic appliances, and perio care. The thick, flexible floss is designed with 2 stiff plastic ends and a spongy middle portion that can hold a medicament for localized delivery. Here you can see the floss being used to clean a dental implant and the prosthesis. Please use your clinical judgment to assess no rough areas or cement or exposed that could cause the floss to fray or shred. Using the stiff plastic end, the floss was inserted at the height of the implant retained overdenture. TePe's dental tape is wide, flat, and coated with a natural beeswax. So when should we recommend flossing? It is when it is a type 1 embrasure space with a pointed papilla. The patient must have the skill and motivation to complete the task. If your patient has difficulty with the technique or low motivation, the TePe Mini Flosser is a great option. The Mini Flosser is a preloaded dental floss holder. It has a unique bite plane to help gently insert the floss between the teeth. TePe is known for our interdental products, but we also have an amazing line of toothbrushes and specialty brushes. With the Supreme toothbrush, there are 2 levels of bristles, with that top layer being tapered and the bottom layer more compact and rounded. This enables more efficient cleaning between the teeth and along the gum line. We have many more toothbrush options, but today we're going to focus now on the specialty brushes. The TePe Universal Care has a contra-angled neck with bristles in a flat design to facilitate cleaning narrow areas. This brush is used for lingual or palatal aspects. You can angle the neck of all our specialty brushes even more by putting them in hot water. It is optimal for retrocline teeth, lingual braces, retainers, implants, tongue side of lower molars when a gag reflex is present, and the back of the last tooth. I really like it because it also fits nicely under bridges or implant retained overdentures, as you can see in the picture. The TePe Implant Ortho Brush has a thin neck with 2 rows of soft bristles. The narrow shape allows optimal access within the vestibule to reach the gingival sulcus along the buccal aspect. This brush is also designed to reach under the narrow area under orthodontic wires and around the bracket. The compact tuft is a dome-shaped tuft with tightly packed short bristles, giving it more of a firm feel. This brush works well for implants, attachments for overdentures, fixed braces, along the gum line, emerging or partially erupted teeth, especially for children, misaligned teeth, and removing surface stain by flaring the bristles out like you would a prophy angle. You can see this in the bottom middle photo. The TePe inner space is a slightly angled handle to reach both lingual and buccal aspects, depending on which side you secure the removable head. It comes in either soft or medium bristle texture and is a single tufted pointed brush to improve access for difficult to reach areas. Again, it comes with 12 removable heads, as you can see here in the packaging. This brush is optimal for furcations, the back of the last tooth, around orthodontic brackets, crowded teeth, cemented retainers, crown margins, implants, and more. It's my go-to for furcations. I've had great success with my patients for that. Lastly, the denture care has extra long, strong bristles to clean the prosthesis. And then we also have ultra soft brushes. The TePe Special Care toothbrush has 12,000 ultra soft bristles, and then the blue version is the same texture but with a compact brush head size. This toothbrush is recommended for brushing after oral surgery and for patients with sore or very delicate oral tissue, very sensitive root surface, extremely dry mouth, and after chemotherapy or radiation therapy in the presence of mucositis. The TePe Gentle Care is slightly firmer and can be used in the next step of healing before transitioning back to your patient's regular toothbrush. So hopefully you learned a little bit about all of the specialty brushes, and we would like to briefly introduce you to the TePe toothbrush program. We're very excited to offer a complete home care package for your patients. Each patient will receive a toothbrush, an interdental cleaning option, closest toothpaste, a goodie bag, and a coupon. We have partnered with Closest to provide a quality toothpaste for your patients. The coupon has a unique code that can be used for 30% off a purchase made on TePeUSA.com. The back of the coupon provides information on TePe's sustainability initiatives. First, you select which toothbrush. You must buy in bundles of 144 toothbrushes with prices from 88 cents a toothbrush to $1. Then you select the free product, either the Easy Pick or Mini Flosser, and you will automatically be provided the toothpaste and a goodie bag. Toothbrush options include the Supreme, Nova, Gentle Care, Good, or Select. The interdental options come individually packaged to provide as a sample, and then once your patient continues to order, it comes packaged like these two pictures here. We also offer different educational leaflets. These focus on different stages of life, whereas these focus on specific situations like perio care, braces, or implant care. So now we're going to take a moment to see how to access the products for both you as the professional and the patient. So you can sign up on TePe's website, TePeUSA.com, as a dental professional to receive that 20% off. We also do have different referral options. You can either use the digital referral option or you can use a paper order form. We also have the practice box. It's a great way to size your patients in office. And when you run out of a specific size, you can just order that 25 pack to refill your practice box. And you can stock up on any of the individual products as options for your clinic to have available to patients. We also have kits in the dispenser boxes. And then lastly, the mixed pack is a great way for you to size yourself and just become familiar with the interdental brushes. Again, one great way to get started is by recommending the TePe products to your patients either through a paper order form or using the digital TePe referral app. If you do use the app, we can track your recommendation, so you do get 20% commission in either monetary form or free product. Our products are through some dental distributors like Patterson, Benco, and DHPI if you want to order through them. So how does the patient get started? The patient may have been given that recommendation either by the paper order form or the digital app from you. Currently, the products are sold online either through tepeusa.com or through Amazon. And then we are sold in some select pharmacies. Simply type in your zip code when you're in the store locator on our website and get access to the nearest point of sale for TePe products. Please note that the stores often do not carry our entire product portfolio, and we are working on expanding access. Lastly, we always encourage subscribing. Has your patient ever said, I had the best intention, but I ran out of interdental brushes, or I forgot to order? It takes effort to reorder, so subscribing is a great way to continue a habit. Plus, your patient saves 20% by subscribing. For example, you could have a 6-pack of interdental brushes sent every 2 weeks automatically. Delivery can be adjusted to any number between 1 to 6, and you can select weeks or months as options. Lastly, how could you grow your business with TePe? We would be more than happy to set up another time to discuss this partnership. But briefly, just to introduce you, we currently have 3 options to grow your business revenue with TePe by using the TePe referral app, becoming part of the TePe affiliate program, where you use links on your website to sell products, or becoming a TePe prescription center. This is where you sell the products in your office. So we thank you for your time today, and we would love to offer you a one-time code to use on ordering practice boxes for your office. Using the code IDB50 will get you 50% off on a practice box with interdental brushes. Please also make sure you sign up as a dental professional before ordering so that you have access to the already reduced pricing. Again, thank you for your time, and if you have any questions, please do not hesitate to reach out. After today, our customer care team will follow up with you. Thanks for having us and your interest in TePe products.